Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and very good morning and salam Malaysia Badani to all Razakian at the Commons Hall, Siswa Uni Razak, Wisma University Abdul Razak, and all viewers including at SIMA Sarawak and Sabah who are joining and watching us through YouTube live streaming. And not forget to our three panelists together with me today, and welcome to Awareness Talk 6.0 Mental Health, Our Mind and Our Right. As an information, this is Awareness Talk is part of our main event, which is Take Care of Yourself, which happened just today. Okay, and for those who will join us today, we're gonna have a meet for Take Care of Yourself event, which is from today 21st until 26th of November 2023. So we have a few events together with us. The first one is Awareness Talk as today. Okay, if you are Uni Razak student or you're just living nearby to Uni Razak or just working nearby to Uni Razak, so I welcome you to join us for the blood donation. We have for the blood donation from Pusat Darah Negara. Okay, and then we have the heart checkup, and then we have the assessment and administration for psychological tests towards to your mental health level. Okay, so if you are living just nearby, so come to join us from 21 until 26. And then for the physical event will be on 21st and 22nd, which is today and tomorrow. Will be on Seminar Hall, ground floor, and then level 9 for the Awareness Talk. Okay? So the main objective of the event to raise awareness among Razakian and the local community about the crucial importance of maintaining optimal physical and mental health. Additionally, we aim to provide valuable insight and knowledge about overall well-being. The event has been organized by Student Experience Department together with Students Representative Council and Uni Razak Indian Club. Congratulations and big applause to all of them. Okay, in Malay we say, tak kenal maka tak cinta. So, I would like to introduce all panelists for today, which is we have on the right hand side, we have Dr. Nur Farain binti Nordin. So she is a medical officer at Secretary and Mental Health Department, and together with that, she is also a person in charge for Mentari Sungai Buloh. Okay, and the middle one, we have Madam Shamil Sofia, but she insists to call her Madam Sofia because she doesn't want to seem like Shamil. Okay, is it correct? Okay, and she is a clinical psychologist at Hospital Putrajaya. At the same time, she's working as a part-time or locum. We call that a locum at Jiwa Damai, which is we call for Pusat Pakar Psychology Jiwa Damai. Been established since January 2017, and the main office will be at Section 7 Shah Alam. So, which is if you just stay nearby to Section 7 Shah Alam, maybe you can just pop in on the center. So maybe you can check for your mental health level, something like that, and maybe you can meet Madam Sofia again. Okay, the third but not least, Mr. Nazrul bin Azizi. He's a counselor at one of the university in Malaysia and graduated from UC Sans Malaysia. And he will join us soon regarding for the session because I've been informed he's not feeling well, so that's why he's going to be late, and then because he got an appointment with doctor today. Okay, so hopefully he's getting well and better and then able to join us soon. Okay, so without further ado, okay, I would like to throw a question to our panelists for today. Okay, sometimes when a patient comes to see us, for example, like from the counselor, okay, we have a counselor in here, and then we have clinical psychologist, and then we have the medical officer working with the secretary and mental health department. Sometimes they doesn't know. So what is the qualification and how they become a counselor, for example, or how they become a clinical psychologist, and how they become a medical officer. Okay. So from now, I need all my panelists to prescribe and who you are basically, and what is your qualification, and then what is your role and limitation as a counselor, clinical psychologist, and a medical officer as well. So anyone to start first? Doctor?
Can
Okay,
I
great.
start first? Okay. Assalamualaikum and a very good morning to everyone. Okay, my name is, can call me Dr. Farah. Working in a psychiatric department for the past 2 years. So I learned a lot from this department actually. So this is my interest, as compared to medical field. Because when we say about the medical field, it's a very broad field. So I already went through some of the departments. So I feel finally I found where is my interest. Yeah. So the question is about the qualification. So basically to be a psychiatrist, of course, first of all need to go through the medical background. I mean, need to take the bachelor in medicine, and then I will suggest if any of you kalau kata memang berada dalam medical student ke, go through first. Go through first to many of other department first and find your interest. Try to search what is your interest in whatever you do. I think this is basically can be applied in other sector also, not only in medical field. So and then after that, if I say about the to be a psychiatrist, then you have to go further to take the master in psychiatry. And this is only, I think kalau sekarang lah ya, memang ada two pathway, either through paper, taking the examination, which is in international level, and then another one through master in public university. Okay, so as for now, I am actually a medical officer, not yet a psychiatrist, but because of my interest actually is more to psychotherapy. So right now I pursue my study in master in counseling, clinical mental health. Okay, so what other question about the limitation? Okay, I think this one actually I already prepare in my slide actually. Tekan. Okay, tekan mana tu? Okay, so it's okay. We mana? Sorry. Okay. So okay, I think atau saya boleh handle dekat laptop ke atau macam mana? Okay, kita straight go to ada slide yang psychiatrist. This one kita akan go through further lah after this about the definition and so on, the spectrum, everything. Okay, it's okay. I just continue first. So basically, of course, as a psychiatrist, you have to come to our clinic, okay? Psychiatric clinic in hospital, either in a private hospital or maybe in a government hospital. And then psychiatrist, of course, the extra as compared to maybe to the counselor or clinical psychologist, as a doctor, we can diagnose the disorder, for example, and also we can prescribe the medication. But of course, the limitation is I think as for now lah, if we focus right now, the limitation, yes, okay. So able to diagnose and able to prescribe the medication, but plus or minus. Because of the limitation in our government setting right now, we have a lots of patients, so we don't have the extra time to talk further. And of course, when patients come to us, they come with an issue, and that is the core actually. And then when we start the medication, but the problem still there, maybe the medication will help in terms of a bit of the symptom, but then the core issue is still there. That's the reason it is important to go to any therapist, counselor, clinical psychologist, or psychotherapist outside to go further, to dig further. What is the issue behind it? Okay, so yep, I think that is about the psychiatrist. Of course, kalau kata dekat private setting, yes, there is ample time to talk more. So yeah, psychiatrist also can provide the psychotherapist. Yeah, bila cakap psychotherapist ni means the talk therapy. Okay, to talk about your problem and then go further. What is the issue behind? Okay, I think and any I'm sorry because I didn't pinpoint the
Just
huh?
jawab.
Okay, menjawab okay, I pass to
Okay. So hi everyone. Wow, my voice is loud, although I'm very short. I hope it's not that loud. Okay, cool. So my name is Sophia. Can call me Madam Sophia or Sophia. Like what I was introduced just now, I'm currently working in Hospital Putrajaya. And so worked before and currently also part-timing in Jiwa Damai, inshallah. So basically to as a clinical psychologist, first of all, you need to have a master's degree in clinical psychology. There are a lot of public. So you a degree and so what's the difference between a clinical a clinical psychologist conducts assessments as they do psychotherapy or intervention. So we do personality tests, but these tests are not the tests that you can find online. Usually they cost thousands, not hundreds of thousands, thousands. Yeah, it's a lot of money involved. Hence, when we are trained in doing assessment. Apart from assessment, you also do intervention, psychotherapy. So let's say, for example, some of you here might be diagnosed, some of you here might not be diagnosed. I don't know. Obviously, you can keep it to yourself, but I know everyone, every single person in this room must struggle with something. There's no human who is not struggling with anything, including me, right? So basically, when you see a clinical psychologist, they will be able to diagnose you. However, we are not able to prescribe medication. We do learn about medication just briefly, but then we are not allowed to prescribe. So meaning, let's say, for example, one of you here might be diagnosed with bipolar disorder type 2, for example, and you need to take medication. But then you come to us. So let's say you go to the psychiatrist or the MO, and then you say that you've not been taking your medication. So usually the doctors will also do psychoeducation. But then when you come to us, the clinical psychologist, we will also be asking, are you taking your medication, etc., etc. So let's say you don't take your medication. Again, we'll do psychoeducation. Okay, but then our main focus is we do therapy. We will focus on what do you want to improve and how do you want to improve, right? So I guess pretty much in short, the limitations of a clinical psychologist in terms of medication, but I guess the strengths would be in terms of assessment. One last thing that I want to point out is with clinical psychologists in Malaysia, it's a bit different from maybe other first world countries where we manage cases from different age groups. So let's say I'm working in Hospital Putrajaya, specifically in Mentari. Later, Dr. Farah will be talking more about that. And even though when I was in Jiwa Damai before and currently in Jiwa Damai as well, we receive cases as early as 3 years old. So usually people will be asking, 3 years old sakit apa? What? So usually children with 3 years old, you will see they have autism and things like that, right? Neurodevelopmental issues. So our cases range from 3 years old to 65 years old. So usually 65 years old, the issues including mood, depression, anxiety, and so on and so forth. Okay, I think that's all.
Okay, well, so we have a two different side, which is we have one from medical term and one from clinical psychologist. Okay, and then just want to add a bit, Madam Sophia, and if you can elaborate a bit more. So what's the difference between psychologist and clinical psychologist? If you can.
Okay, so basically a psychologist, to be very honest, right, if you have done a degree in psychology, you are allowed to become in under Kementerian, under KKM or the Ministry of Health, you are allowed to become a pegawai psychology, right? So in a way, you are a psychologist lah. But then the difference is you are not, you do not have any specifications. So there's a lot of types of psychologists. There's developmental psychologists, there's clinical psychologists, there's sports psychologists, there's a lot of psychologists. So usually for you to become specific, you need to do a master's in it. Right. So but in Malaysia, usually what we have, what I know is usually developmental as well as, oh my God, there's another I've forgotten. It's related to jobs. Oh my God, I can't remember. But yeah, there's another type of masters in psychology where it's becoming more and more apparent. People, it's related to HR, job security, and so on and so forth. I can't recall. Okay. Yes, thank you so much. Organizational psychology. Yes, thank you. Okay.
Great. Okay. So I'm very welcome for our third speakers, which is Mr. Nazrul bin Azizi. So welcome. Thank you so much to join us. Even though we mentioned just now, you're not feeling a bit well, but you still come to join us. Thank you so much. And basically, to be honest with you, he's my senior, my master at UCSS Malaysia. Okay, he's the first batch for master in counselling at UCSS Malaysia. Batch is junior. Okay, such a great man. I've been with him for a few programs when I was pursuing my master. So welcome again. I'm not sure I should call him a doctor or Mr. Nazrul. Is it Nazrul or what? He's still Nazrul or Dr. Nazrul? Okay. He just completed in psychology at University Malaya. So that's why it's okay. I hope he don't mind if I call be set for Dr. Nazrul. Okay. Okay, great. Thanks, Nazrul. Okay, I just want to ask a question again. I just mentioned to Dr. Farah and Madam Sophia. And sometimes people are a bit confused, and people will saying how to believe we are a counselor, we are registered counselor. And to be a counselor, so what is qualification we should have first? Second, and what is our role and limitation basically? If you can explain a bit more to our audience in the hall and through the YouTube class as well.
Shafiq, I think this is our first time jejak kasih. I mean, like for almost 10 years, I haven't met my junior, so-called not junior sangat lah. When we was together back in the USM, it's a counseling master in counseling, and I would like to apologize. I came from hospital just now for my checkup, but of course lah, because hospital there's so many hassle inside there, especially government hospital. But alhamdulillah, because I was like already promised with Shafiq, my commitment is there, even though I'm late. Back to your questions, there is a lot of limitation for as a counselor. First of all, we are still in a stigma in Malaysia. Meeting counselors is like you having a problem, maybe you have some sort like referral from anyone, but meeting counselors or having an appointment with counselors doesn't mean you are weak or you are having a vulnerable situation. Back when I was 2015, I have some training in the United States with the counselors from there. it's just normal to see counselors for your improvement. That was my new book will launch this Saturday, Unlock Human Potential. To improve yourself, you need someone to coach you, to guide you. That's why in USM we got master in counseling, then bimbing and counseling to guide you. So technically, it's nothing wrong to see counselors, but there is our limitation because in Malaysia there is we don't have really clinical counseling. Because, we don't have that yet. Maybe in the future we cannot diagnose. So now in Malaysia, those who want to diagnose only clinical psychology. At that stage, they have even the counselors. They can advise the medical doctor or psychiatrist to give medications. That's how powerful counselors. So in Malaysia, we have some limitation, and we also have Akta 580, which is, I think, Akta 580 was early 2000. Maybe need to have new, fresh idea for the act. Maybe because we have so many limitations in terms of the roles of counselors and everything. And I believe this is maybe online. Counselors have to be independent, not to be inside in Ministry of Women. They have to be independent. Even clinical psychologists have to be independent because we are professional. I believe when they are professional, there's no one can touch us in terms of political or any element. That is my answer. Okay, thank you.
Thank you, Nazrul, for the response and then feedback. Just want to add a bit. If you want to become a counselor, because before back to 10 or 15 years ago, if you have a diploma in counseling, should be enough or you are entitled to register to be a registered counselor. But back to like Nazrul said, 2000, and then for those who want to become a registered counselor, the minimum qualification you should have is Bachelor in Counseling, which is pure counseling, or Bachelor in Guidance and Counseling with honors, which is untuk pendidikan. So that's you be entitled or eligible to register to be registered counsellor under Lembaga Counsel Malaysia. Okay, and then just a bit conclude with that. So we can see a bit of limitation what counsellors we have, and then same goes with clinical psychologists and then doctor as well. So like counsellor, we do not have any qualification, or we are enabled to prescribe or do something like the therapies or psychotherapies to the patient towards the mental health. But goes to the clinical psychologist, they can do that. But still have the limitation of not able to prescribe for the medication. So don't ask the clinical psychologist. It might be they able to advise you, okay, but they are unable to prescribe for the medication. But the right person, if you want to see what kind of medication you should take regarding for mental health, see a doctor, specialist in psychiatrist. Betul tak? Okay, right. Correct me, I'm wrong. Salah. So only the doctor with specialist, with psychiatrist able to prescribe your medication. Okay, it's not like a general doctor, not a medical officer. It might be Dr. Fahad in future. InsyaAllah, boleh untuk prescribe.
Like right now, I'm a medical officer, but we can prescribe because basically being supervised by the psychiatrist. Yes.
She can do, but still under supervision with the psychiatrist. Because she's working under secretary and was it mental health department. Okay, she can do that. And plus for the therapist. So that's the differences between us. So that's why we bring up together today. We have a counselors in here and a clinical psychologist, and then we have also for the medical officer. Okay. First for the question number 1. So I'm gonna move to the next question. So it's more towards like for definition of mental health. Okay, because people will say but sometimes we're not sure. So what is the mental health? And what is the mental disorder? And what's the mental problem? And what is the well-being? Sometimes we say, oh, all of them is the same, and then all of them is similar. But the thing is, and the reality is all the words I'm saying just now is have a different meaning and different different explanation. So again, I want to throw all the floor to my panelists for today. So what is mental health and well-being basically, and how we can differentiate between the normal variation of mental state, mental problem, and mental disorder. Okay.
I start first, Okay. So basically, I will go to my slide. I will explain first, and then maybe can other two panels can add on after this. Okay, so basically what is it? Because we want to know what is the mental health well-being, yeah, mental health, and then what is the spectrum? Okay, so kita proceed to the next slide. Okay, so this is basically about the statistic, about the prevalence of the suicidal, which is increasing years after years. And kita suspect, yelah, maybe this is underrated some more. Okay, so next. Okay, so mental health is our emotional, psychological, and social well-being. It directly affect how we feel, think, and act. Okay, so of course, when we see this, we want to see this as a spectrum rather than black and white. Okay, it's not that one has depression, one doesn't have, one have anxiety, one doesn't have. Yeah, so this is a spectrum: mental well-being, mental health problem, and another at the end of it is a mental disorder. So when we say about disorder, I will explain further the definition of it. Okay, so next. Mental health. So according to WHO, it's a state of mental well-being that enable people to cope with the stress, realize their abilities, and then learn well, work well, and contribute to their community. Okay, so basically when we say about this, if we feel that we still not contribute, okay, to any maybe to society, maybe to family, okay, so we want to check where are we at that point of time. Okay, so next about the mental health problem. According to Mental Health Foundation, these problems are difficult experiences that make it hard for us to get on with our life. Okay, so next, so this include painful feeling, thought that we all have at times. Okay, adalah perasaan-perasaan yang lain. Okay, maybe the sadness, maybe the hopelessness. Yeah. So this is not a weakness. We have to emphasize on this. This is not a weakness. It is an emotion, something that we feel, and then if by time dah settle, we let go. Okay, so next. Okay, this is my part, which is the mental disorder. According to WHO, the mental disorder is characterized by a clinically significant disturbance in an individual cognition, emotional regulation, and behavior. So it is usually associated with the distress, impairment in important areas of functioning. So kita fokus dekat impairment. Memang ada effect dekat function level. Maybe dekat social, maybe dekat contoh kalau as a student during study life, yeah. And then next, so kita akan tengok this is as a spectrum, but then I want to introduce another spectrum which is suggested by model, dual continuum model. So when we see this mental health and mental illness, so kita ada, mental health, kita tengok first dulu mental health. Kalau mental health, good mental health, but no mental illness. Okay, contoh kita bagi good mental health but no mental illness. Yes, it's flourishing. Good. Can be successful. Okay. Okay. Then we see that the same person with no mental illness but low mental health, penat, letih, yeah. So jadi kalau kata kat dalam keadaan ni, kita nak ke mana? So nanti kita akan discuss further about this. Okay. So next, another person with mental illness but then good mental health mean he has the insight. Dia tahu dia ada sakit, but then he takes the medication, he go to the therapy, and then he's okay, maybe he struggle, but then he can continue his life actually. Okay, next. With mental illness, but then mental health is low. This is the condition where the patient may come to us and we start the medication and so on. Okay, so I think maybe about the mental disorder lah. Dekat klinik kita ada macam-macam penyakit, but mainly this is the category neurodevelopmental, schizophrenia, bipolar, depression, anxiety, OCD, substance, and also neurocognitive. This is the most common that we see on daily basis. Yeah. But other than that, yes, of course kita akan tengok juga lah in between. Yeah. So maybe additional point from our panel.
Okay, so I think Dr. Farah has explained a lot. I do not want to add much, but I just want to say one thing. The point is when you have a mental disorder, your function is affected. You cannot function daily, you cannot function academically or occupationally. Your social functioning is also affected. I give you an example. You guys are university students, kan? So let's say I am assuming Uni Raza, you guys are staying outside campus. Outside campus, kan? Okay. So you wake up in your room and then you suddenly feel like, usually you will feel malas ni nak pergi class. We don't want to go to class. But when you have mental disorders, what happens is it's not only malas nak pergi class, it's not only the laziness, you just cannot push yourself. You just feel like everything's empty, you just feel like lying down, you don't want to do anything. Even when you're lying down, it's very tiring. Yeah. So some people are nodding. Yeah. So basically, that shows that your functioning has slowly reduced. So let's say you cannot push yourself anymore. What happens is you start missing classes. So people don't understand. People start saying you like to skip class. People don't understand that you have an issue at hand. So and then you don't eat. You don't eat, you don't take your bath. People who have depression, they may not go taking their bath for 1, 2, 3 days, right? The more severe you are, the lesser functional you are. That's why it's very, 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 very important to realize that if you are in distress, you need to seek for help. I recently did a program on addiction. At Precinct 11. So my clinic is in Precinct 11, Putrajaya, Precinct 11. So and then we did a program on secondary 1 to secondary 3 students. So they were talking about addiction to gadgets lah. So we all have gadgets. I don't think no one does not have. To cut it short, these students as early as 13 to 15 years old, they say that they have been skipping school a lot. They don't have the motivation to go to school. These students are affected due to not only addiction can be one of the pathways, but then because when we talk more, these students say that when they have problems, they usually like to keep it inside. You guys are young adults. As you grow older, sometimes you feel that people don't understand you. Either you keep it inside or you choose a wrong coping mechanism. We call it a maladaptive coping mechanism to manage your stress. So in short, what I would like to stress is if you feel that you have issues and you feel that you don't know, you find someone who you can trust to talk to lah. I'll recommend a counselor, of course. But then try to seek for help. One last thing. If you see a therapist, i.e. a counselor or a clinical psychologist, and you feel that person is not suitable for you, continue finding. One analogy I like to give my patients, let's say at school, right? Let's say you took mathematics. So there are 5 mathematics teachers in one school. So let's say your teacher is Cikgu A. So one day Cikgu A maternity leave. 3 bulan tak ada, 3 months tak ada. So another teacher relieve. You don't like that teacher. Does it mean that the teacher is bad? No. Does it mean that you are bad? No as well. It means that you guys just don't jive. So continue searching for someone that you can trust. Okay? That's all. You want to say anything?
No points anymore. Both clear. psychology and psychiatric share. But I just want to quote it from WHO in 2020. Mental health is equal to physical health. All right. But let me bring to another definition of mental health in 2023, which is we equal to well-being. All right. There's in the mental health there's an umbrella that we may be. Let me bring you another definition about mental health. We have 4 elements. First is emotional well-being, which is how yourself manage your emotions, how yourself manage your emotion and emotion people around you. All right. And number 2 is psychological well-being, which is how you have encompassed the acceptance, your resilience, and who you are around you in your current situation. And another part is social well-being, which is how your relations with your friends, your lecturers, your neighbor, your housemate, your hostel mate, their social well-being. All right, that's part of that we have to take care of. Another part is, last but not least, is which is we are having a very difficulties right now. Everything is increased, harga ayam turun naik dan sebagainya, things like that. That is a financial. And we make sure ourselves we control that few element well-being that we're having right now. Inshallah, that your mental health, that what called the checklist of your mental health will be better and better. Those who have difficulties in their mental health. That's something I want to touch a little bit. All right.
So can I take to the Farah some kind of definition of mental if you were to explain to my students and then through the YouTube live. On the easy to them.
Okay, so basically, like we already explained before about the spectrum. Okay, so of course there is no, like when we say about the spectrum, it's a gray area. It's not like a scale from 0, 1, 2, 3. No, okay, it's a gray area. So, but then we can see that along the way, if any part of your life is affected, for example, your sleep, or maybe your social part, you start to withdraw from everyone, okay, and then additional cannot focus, okay. So we of course kalau kat klinik kita akan check lah, dia macam checklist jugalah okay. So one after another, so we have to focus what we have right now, or what is the, like before we already achieved this kind of functionality, but then now start losing it. Contoh mungkin minat, dulu minat buat ni everything but then right now malas, tak nak bangun, whatever. So jadi kita akan tick one by one and check again. Okay, how about your sleep? How about your social? How about your interest? How about your focus at work or at during class? So but then and then of course kalau kata ada apa-apa yang merisaukan, then check. Maybe you can come to your counsellor. Okay, and then if anything that maybe kalau kat counsellor pun boleh buat kan, test ke apa kan, kita buat screening, and then if there is a need to refer to our clinic, then yes, take the referral and come to our clinic actually.
Great. Thank you so much, Dr. Thank you so much, Madam Sophia and Azrul. Great. That's a good explanation about mental health and well-being. Easy word to say, it's going to be what kind of symptom, what kind of trigger through your life is going to be effect towards your mental illness and mental disorder. So please check your mental health level going to be effect to your mental disorder in future. Okay, great. So I'm going to start with the first session. I'm going to cross to all audience in the comments to the audience through the YouTube live as well. If you have any question or inquiry, okay, you just stand up and someone will pass the microphone to you and then you just ask the question straight away to our panel. So the best is state the name of the panelists and they can able to explain or answer the inquiry direct to you. Can like that. Can. And same goes with our viewers at YouTube Live. So if you have any question, state the panel's name and then they're able to answer your question. Okay. So I'm going to pause to the floor and then the YouTube channel. If you have any query or question, so I'm going to open the floor to you right now. Kalau tak ada, I will ask the panel the question lah. Okay, great. We have one. Please state your name if you can. The question you need to send to whom then?
Hi, my name is Wani. My question would be that maybe to Mr. Councillor, yeah, sorry, I forgot to catch your name just now, but I think there was a news article before that there was not enough councillors by certain, I think I'm not saying which year, they won't have enough councillors to the ratio of Malaysians. Now, actually, and usually these kind of issues, especially being in university life, is very stressful for students. That's the number of councillors. What is your suggestion or ideal number of a councillor to the student ratio at a university? That's all. Thank you.
Okay. So the question is, Mr. Nazrul, it's going to be like this. And then, so from your perspective,
I know what's in this. Okay, very good. There is no guideline from any of our acts in the Lembaga Councillor to ratio per students. Currently, what the practice from Kementerian Pelajaran Malaysia for one councillor, 500 students currently. And for the university, there is no any evidence from Lembaga Councillor put that 1/1000, but not yet any evidence to it. But I wish if you personally, if you go to developed country, 1/200 for councillors, there is a proper ratio. But only 9,000 registered councillor in Malaysia. We are way back from other developed countries. So we need more people like you are doing a degree in whatever, master in counselling. Keep register, keep practicing. You are professional.
so any more question? Yes, we have one at the back, I think.
Hi, my name is Zanira. So I have a question to any panel. So firstly I nak cerita dulu. I do have a friend who has mental health problem waktu sekolah dulu. And then bila dia cerita kat guru kaunselor dia, and then suddenly that cerita leak out. So sekarang ni dia ada masalah trust issue with friends, anyone. And then macam mana kita nak pecahkan stigma yang macam trust issue ni di mana hospital pun boleh tolong dia. Sebab dia hospital pun tak nak pergi. Contoh. Macam tu lah.
Okay. So more towards on stigma probably. Okay. So this is one of the question we're gonna ask our panel after this. So we keep that question for a while. Okay. Can I not? Can I? Okay. So keep the question for a while because we have a special question in after this towards of stigma. So that one is more towards the trustworthy stigma. Okay, we're gonna answer that. Any question more from the hall or any question from the YouTube live as well? Yes, we have another one here.
Using mic. So I just want to ask a question to Madam Sophia. Okay, so Madam said that to take one test regarding the issues, so it costs like thousands. Madam said that, and then to go to a counseling also costs much. So, your suggestion to other for university students we do have counselors. So what are others who are not able to for a session, or if they have also trust issues, what's your solution? Thank you.
Thank you. I didn't catch her name.
I'm Divya.
Sorry?
Divya.
Divya. Oh, okay, cool. Divya for the question. I have two messages now to add on. The test that would cost thousands to basically is the test. But then when you want to take it in the government setting, it's free of charge. But that is used Sparta. Other tests, they will not cost as much, huh? Okay, but then to answer your question as well, I would strongly suggest there are many NGOs nowadays who also offer clinical or psychotherapy services. One that I think most of you know, and I think you guys know more. If you look on Twitter, TikTok, I think you can find a lot of this, right? Befrienders can be one. I heard that they also have overwhelming number of calls as well. You can also go, Miasa also has offers actually psychotherapy services. They also have visiting CPs if I'm not mistaken, or trainees, and they also have counselors if I'm not mistaken. Try to find other NGOs. There's so Minda Kami is also, but I am not sure in terms of the range. MMHA is another place that you can apply, especially if you have issues with finance. Usually these NGOs, they would have like a review. The cheapest would obviously be government setting, but it'll take a long time, right, due to the number of patients. So in short, you have government, you have NGOs, and you have private settings, right? Okay, I hope that answers your question. Thank you. Yeah, sure.
All right. Actually, our government under Kementerian Kesihatan Malaysia, we have National Centre of Excellence Mental Health. Talian dia 1555, Talian Hill. So it's better you use a proper, I'm not from KKM like Bogan, but I promote because it's better you actually use the Kementerian Kesihatan punya talian, because I'm not sure this non-profit, they are well trained, they are or not. Because Kementerian Kesihatan Malaysia, they have proper counsellors, in-house psychiatrists, and also they have clinical psychology. So remember 1555, because I'm from NGO, so I have my NGO, but when I see some of them, I'm not saying all, some of them I'm not well prepared. But it's better you use the Kementerian Kesihatan Malaysia. They will connect you the whatever you're having situation. Thank you.
Okay, that's a good explanation from our speakers and our panelists towards the question. Okay, I'm going to share a bit regarding information towards to Divya or to my beloved students in here and through YouTube Live after this regarding for some kind of talian or kind of connection you can find either under NGOs or under what do you call it, under klinik kesihatan, or is it under fully government or half government or totally private? I can share with you after this a bit, the end of the program. Now, and to back to the analysis based on my question. Back to the question from, what's the name again? I forgot the name. Regarding for the stigma, and then I'm really interested with this song. I'm not sure, I think you heard this song before, and then all the panelists, even though it's not our age, but I think he's, I would say, the first, I can say the first singers in Malaysia been produced the songs towards the mental health, and then featuring with Zainakal and Yoni Boy, and then the song is Sakit. Okay, the kind of the vibe of the songs can say like tapi aku sakit bila ramai keji. Okay, sakit aku bukan sakit di hati, jadi sakit aku pendam sendiri, rasa sakit ini takkan berhenti, mengerti, ku terpaksa hadap walau penat lari, ku terpaksa jatuh bila penat diri, dan ku terpaksa hilang walau ramai. So that kind of stigma been played around the world. It's not only in Malaysia. Okay, when I traveled towards UK 6 years ago with my family, I speak one of the counselors in there. They signed, even though we are, I would say, kind of negara maju, okay, United Kingdom and not England, they still have a stigma play around towards the mental health. Okay, for example, in Malaysia, when talking about mental health, straight away people will say, you are crazy. Sorry to say, kepada pasal mental health. But this is truth. Okay, this is the truth. Yang kita kena cerita kepada semua orang. It's common. Okay, you are crazy. You are not belong to the community. Second, and you are useless. But the thing is, I have one case. This is what happened to my patient that time, and then this is the stigma being produced to him when he's having for the mental health. And the end of the day, he just MIA, missing in action. Okay, disappear for a few weeks and suddenly come back. So this is the stigma, and to go together with the stigma of trustworthiness, I want to ask and throw the question to all my panelists today. Okay, and then as we know, we have two stigma, which is we have self-stigma and then we have public stigma. But the question is in here. So what is self-stigma and what is a public stigma? And second, which one is getting more effect to patient basically? So anyone can start first. Maybe Madam Sophia? Or asyik doktor tu kan? Pass the baton to another one lah.
Okay, so the difference between self-stigma and public stigma, I'll include the answer to your question as well just now, yeah? Self-stigma is basically when you yourself have negative perceptions of your own mental well-being. To be very honest, right, a lot of my patients have this stigma within themselves. We don't want to make it like, some people might say, oh, men have more stigma or women. To be very honest, it's across genders. There are a lot of people, so that's self-stigma is about there are a lot of people who have mental disorders. They can't really agree to the idea that I have an issue and I have to take medication. So that's why that, without them realizing, that actually hinders or impede the treatment process, right? That's number one. Public stigma is how others view you. To be very honest, right, as much as on social media, there's a lot of awareness increasing related to mental health issues. I honestly believe that if you talk with a person face to face or in a physical space, you can feel that there is still a lot of stigma. If you say to someone you have depression, it's not the same how people will look at you as if you say to someone you have cancer, to be very honest. For example, let's say you say to someone, let me God protect us all. I have cancer, for example. Usually people are like, oh my God, kesiannya, how are you? But let's say, for example, if you say to someone I have bipolar, people will start being scared. And usually you can see from the faces. They start feel like, oh my God. The stigma is still there, to be very honest. So that it actually has a reciprocal relationship. When the public stigma increases, the self-stigma will also increase. Imagine if you have, let's say, BPD, borderline personality disorder. Some of you might have heard of it. If, for example, you have BPD and you tell people you have BPD, people start Googling. Obviously, when people start Googling, people will be like, oh, so dia ni suka self-harm, this person has problems with relationships, I don't want to be friends with her lah. Dia menyusahkan, for example, right? And then this person starts to be isolated. What happens, the public stigma is that the person's stigma towards herself increases. The depressive symptoms, there's a relapse in depression. Patient comes to us and say, I'm just worthless. People don't want to be friends with me. They find me very difficult. Hence, the stigma is still there. All right. So before I pass to the other panels, to answer your question, the pretty lady in black hijab, I don't know your name, I'm sorry. So I just want to say that unfortunately, I don't want to back up any professionals, but unfortunately, there are certain professionals that are not able to, I would say, maintain privacy and confidentiality. All right. Be it counselors or doctors or even clinical psychologists, it does not mean it's only counselors and so on and so forth. What I would say is, for that friend of yours, it must be very hard, I can imagine. If I am in her place, I think I'll have trust issues as well. What you can do, I think, in your own capacity is to listen. Maybe usually people like this, if they have mental health issues and if you continuously suggest, they are, to be very honest, right, when they have this view, it's actually more of the fear. They fear that if they see someone else, the person will do the same thing. The impact is really big. Imagine, you don't know my problems, right? You guys don't know my problems. I have problems as well. So let's say if I go to this man, this young gentleman in front of this camera, looking at me right now, in this blue shirt. Imagine if I go to him, let's say he's my therapist, I suddenly become all vulnerable. I tell him my problems, but let's say anything related to my life, suddenly I know he goes to another and tells, including my name and all. Kan kalau kita discuss case, we usually make it anonymous. Tapi this time say, you know tak, that patient tadi, yang baru balik tadi ni, dia ni ada macam ni. How would I feel? If let's say I heard, obviously I don't believe in him anymore. So how do I expect, so we cannot expect your friend to always believe. So coming back to the point, I would strongly suggest you to listen. If she could see that you or other friends can be a good listener, you can use something along the lines of, if I could listen, maybe someone else could listen, and maybe someone else with a proper background that could help you. I cannot help you, I can only listen. And then from there, you can help her start searching for places yang dia rasa dia boleh percaya, people trust her. Maybe because it was in a school, the counselor know other teachers, she knows the teachers, that's why people can spread it out. If she goes to, let's say, a private center, or let's say she goes to, let's say, Mentari clinic, right? Other people don't know her. Maybe it might change your perception of that, right? So that's just my personal opinion. Other panelists might have their own opinions as well. Thank you. I hope I answered your question as well. But all the first becoming a listener, I root for you. Okay. Next.
Motion.
Okay, maybe I will add on because I'm in hospital setting jadi kita ada stigma tu dia mungkin lebih mendalam lagi-lagi kalau kes yang very severe. Okay, we are not 30 years back yang kalau ada skizofrenia tempatnya kat mana? Anyone? Tanjung Rambutan. Okay, kita ada banyak kes yang datang kat kita, doktor boleh tak hantar ni balik pergi je Tanjung Rambutan, not even try medication yet. Okay, so our aim is actually we want to bring back all these patients back to community. Okay, and we believe that patient can try further, boleh berjaya dalam community pun sebenarnya. Okay, back then memang tak ada ubat. There is no antipsychotic, so that's the reason they kumpulkanlah everyone dekat satu tempat. Now no more, we want this patient back to the family and then contribute to the family. Okay, so of course benda ni dia ada spectrum lah kalau kata pasal contoh schizophrenia, we believe early treatment, early intervention can help patient back to baseline, even paling-paling pun lah as close as baseline before. Boleh kerja, boleh kembali ke dalam masyarakat. Okay, so this is where we see the stigma. But of course, bila kita cakap pasal stigma, okay, the awareness is increasing now, which is good. Okay, people start coming to our clinic. Okay, so which is good, but I hope in the future kita ada bridge the gap lah between the counsellor and also clinical psychologist sebab awareness increase and then people keep coming to psychiatric clinic first without try to discuss first the issue with counsellor, for example. Banyak in between tu yang tadilah yang kita kata the spectrum kan, mental well-being, and then kalau ada problem why not start search for help, seek help. Okay, cari, kalau kata bincang dengan counsellor first, and then kalau kita kata nampak okay this is getting worse and worse, why not kita refer ke psychiatrist? Yes, no issue, please come. Yeah, okay, maybe other.
Sorry. Alright, to reduce the stigma, I bring 4 points here. The first point is we need to have open conversations. The open conversation, students, staff, they will have a safe zone to talk about. All right. And another part is I believe that we can share about the education and awareness. We have a physical education. We don't have mental health educations. I think we should start subject in the university mental health education. There's only one credit hour for anyone can take elective. There's another, I think, can start with Unirazak, because Unirazak maybe is very flexible, university very open, like advanced. To start in IPTA maybe is something to go to KPT, whatever, maybe Encik Shafiq can start mental education. So 1 credit hour, you know. So students, maybe counselors can be part of this. Open, there's more accurate information about mental health. When you have a proper education or awareness, we need to talk about mental health. It's not only one off like this or 1 week like this. We have the mental health is a journey. They have to be proper place, proper education, open up and have a better information. Another part is a media representative. Media play a better role to end the stigma, because I believe we need to put some acts about media, how they promote mental health, keep promoting about mental health, give some awareness about mental health, not just on only October 10, you talk about mental health and then another the whole year you forget about mental health. So you need to keep repeating, promoting about mental health. And then cultural sensitivity. Some of the culture maybe they believe that mental health ni macam contoh kata gila dan sebagainya. Padahal psikosis ataupun tadi yang doktor cakap tu, we can actually we can really have a proper treatment dan sebagainya. And last but not least, peer support. Peer support is important. Maybe start with Unirazak. We have some peer support group, peer support programs. Every weekend or every Friday, everyone can have a safe zone, safe talk to share something very vulnerable. That's something we start the conversation with end the stigma. All right, thank you.
Thank you to the panels. Such a good explanation. And then just adds a bit more towards the question from the students just now. And then add a bit from Madam Sophia. If you can be a good listener or active listener, go for it. So what you can advise or what you can help your parent, your friends basically. So you have that that matters. You have that issue. So basically, you have like a middle person between your friends to the mediator. You become a mediator between your friends and then to the professionalism. For example, you can check your friend's matter or friend's problem to the counselor. Basically, for example, so let's say you meet Madam Sophia. So in this kind of situation, what I can advise to my friend basically. So this is not my, but I just become a mediator between two parties, which is your friend and professional. So this is what I'm always saying to my student. If they come to see me and then they say, Shafiq, this is not my problem. This is my friend's problem. This is my family problems. So what you can suggest to me to help my friends and my parents. So this is, you become a mediator to your friends and then between your friends and the professional. So from that information given by the professional, you can pass to your friends. This is how you can help your friend basically. So go for it, keep it up to be a good listener. Sebab tak semua orang boleh jadi good listener dan active listener. Okay? So tak semua orang. Even though, to be honest, counselor pun kadang-kadang lepas 45 minutes an hour, dia fed up. Okay? Dia become fed up. So they need some time to to clear our mind untuk dengar pada kes-kes yang lain. So if you can become a good listener, active listener, maintain and keep it up. Don't stop. Okay? So that I can share a bit for you. So how you can help your friend to get able to touch with this stigma or issue. Okay, great. This is our last question from moderator to our panel. Okay. Towards the WHO or World Health Organization signed 10 October is mental health celebration, or I would say Minggu Mental Health for around the world. It's not only for Malaysia, it's around the world. And they sign our mind, our right. This is what we're talking, the topic of today. And the caption as well, mental health is, what do you call it? Just see just now. Mental health is mental health is a universal human right. Okay, so this is kind of thing we try to ask my panelists today. For those who suspect they are maybe facing mental health challenges or mental health issues, so where would you recommend they start seeking for help or guidance? Is too easy to say. So what is the first step they can do if been diagnosed or been built up a symptom of mental health?
Sorry, so the question is, what would be the first thing that they should do? Already diagnosed or not yet diagnosed?
Been diagnosed.
Oh, okay. So, I guess let's divide into two lah. Number one, you're not diagnosed yet, but you feel something is super wrong with me. You feel that. So, what I would strongly suggest, like what Encik Allah, Nazrul. I was thinking of Encik Azlan. Encik Nazrul. What Encik Nazrul was saying just now, you could call the Talian Hayat or the line under KKM, or other seek help from other private centers or other counsellors. As long as the keyword is, as long as you feel that you are not functioning like how you should do. You should be going to classes and you're not. You should be completing assignments and you're not. You should be focusing in class and you're not. You should be, but you're not. Okay, so that is if you're not diagnosed yet. So if you are already diagnosed, I strongly suggest you to, first of all, please, some of you, if you are diagnosed here in this hall, please take your medication. Yeah, take your medication. A lot of people feel that if they take their medication, then they'll be addicted to it. They're afraid of the side effects. We have to understand that our bodies, each of our bodies are different. So if you take one medication, there might be, obviously the side effects will be there. And there might be medications which do not suit you. That's why seeing the doctor, following your appointments are really important. Okay? Apart from that, seek for psychotherapy. Like now, I think this is just in treatment, right? According to, I honestly don't remember when the research was published, but I think it was the last 2-3 years. They were talking about the efficacy of treatment. First of all, the most efficient is when you take medication and psychotherapy. All right. Second is medication only. Third is psychotherapy only. Why? Because when you have a mental health issue in your brain, there's what? Yes, there's imbalance. There's chemical imbalance in your brain. So you need medication. Psychotherapy couldn't just change the chemical imbalance to make it more balanced, obviously. That's why you have to take your medications, right? At the same time, if you take psychotherapy and you don't like your CP, you don't like your counselor, find someone else. Do not stop there. Do not feel like, I do not like her. I think she's not helpful for me. I'm going to stop. Don't do that. Remember, let's say, anyone here, okay, I'll not ask lah. Anyone here does not know diabetes? Obviously, you know. Anyone here who has family members with diabetes? Oh, is it? I see. You want me to tell her? Okay. Oh yeah, he has diabetes as well. So when you have diabetes, I'm not a medical doctor, so obviously Dr. Farah will know more. But what I'm trying to say here, when you're diagnosed with a certain medical condition, obviously you have to start your treatment. The problem with mental health issues is the difference with physical issues, physical illness, you can see that person is not okay. But with mental illnesses, you cannot see that person looks normal, right? So when you think that you look normal, you don't want to take all this medication because you don't want to feel abnormal. Don't do that. Problems can become more severe, right? So in conclusion, to answer the question, please make sure if you're already diagnosed, go for the treatment plan. If you feel that you don't agree with one particular place, go to another. I have to emphasize that a lot. I have a lot of patients who stop seeking treatment just because they don't like one particular person. Okay, thank you.
Right, Doctor?
Okay, so about okay, maybe I just continue about the medication ya. So anyone kalau kata bukan diri sendiri pun, anyone close or your friend ke yang taking medication. So kalau kata ada, please yes, first continue the medication. If you feel that you are in a state very very good mental health and you dah kata recover lah please discuss with the doctor first before you stop the medication. Kita tak nak macam stop prematurely and then relapse happen again and again. Okay. Kita punya question apa ya tadi? Okay, what should we nak pergi mana ke? Okay, okay. So kita maybe boleh kita fokus pada kita punya slide lah. So where to start? So of course kita ada counselor, clinical psychologist, psychiatrist ya. So again as a spectrum, saya kata kalau contohlah mental well-being, okay je tapi nak discuss something with counselor, no issue, betul tak? Betul, boleh. Okay. So kalau kata maksudnya ada nak discuss about the career or maybe specific problem at that time but not affecting your mental state. Okay, still boleh. Okay. To improve stress management, coping skill, discussing on any issue. Okay. But then of course again and again, I repeat again and again, same with Madam Sophia, kita sebut pasal functionality. In any cases yang kalau kita nampak our function is affected or harm to others or to self-harm lah suicidal. So maybe this one, yes, this is kita kata emergency to our department. Emergency. Kalau kata emergency for medical, maybe kalau auto ke is a trauma case for example. But our case, emergency is something that harmful to self or to others. Ya, boleh pergi KK boleh, pergi ke klinik psikiatri boleh atau ke kecemasan lah ED. Ya. Next. Okay lagi next. Rasa ni dah terbalik ni ke depan. Rasa terbalik ni. Forward. Okay. So where to go Of course kalau kat institution we have the counsellor, maybe some of institution ada clinical psychologist. This is where I want to introduce about Mentari actually. Okay. Mentari assessment clinic, Mentari can refer to psychiatric clinic afterward. And then another way is klinik kesihatan. Now we are trying to emphasize that KK also can, because right now KK also has family medicine specialist. So they can diagnose if any like macam depression or anxiety did. And then right now is coming to new situation lah sebelum ni KK tak start ubat, but now they are starting, can start medication before refer to our clinic. Kalau kata simple case, KK can continue follow up there. Okay. And then another one, of course kalau nak cepat tu private psychiatrist. Okay, Mentari so next. So Mentari, we have, this is actually Pusat Komuniti Kesihatan Mental. We have about 30 plus Mentari all over in Malaysia. So can go to Mentari website. Kalau Google, memang Mentari atas sekali lah. Just click and then dekat Mentari ni we have the ujian kendiri. So anyone yang kalau kata nak try test, tengok diri, can do the self test there. Ada DAS, ada PHQ-9 So and then after did the test and then there is a next. Okay, kita ada boleh request appointment. Dia ada show the result and then kalau you decide you want to seek help, you can go. Okay, I think this is actually the macam fast track. Sebab kalau kata klinik psychiatry, you have to wait at least 2 to 3 months. Some clinic provide the walk-in clinic, but then not all government hospital. So another way is actually through Mentari. Usually the waiting list at least 2 to 3 week, 2 to 4 week lah, about that. Okay, so it's faster. But of course, kalau kata emergency, self-harm, or suicidal, or harm to others, yes, direct to emergency department. Yeah. Okay, I think that's all. Ada lagi ke? Okay, yeah. You are not alone. Please reach out. Yeah. Okay, thank you.
Can I add a little bit? All right, thank you. I just now add a little bit from the doctor and clinical psychologist. First of all, when you've been diagnosed from any clinical or psychiatric, the first, you have to understand your diagnosis first. Ask doctor proper. Ask your doctor, ask what is the condition, kalau betul-betul you are depression, what kind of level you are depression. Don't just simply dengar lepas tu balik macam tu. Okay, ask them because the doctor will help you. If the private lagi lah you bayar kan, you have to ask proper, listen to them, take your time to admit that. Another part is I want you to seeking treatment plan. What is the treatment plan from your whatever your situation, either nak pergi terapis ke, nak makan ubat ke, some of them, because we are professional. For example, the pakar psychiatry, dia dah tahu dah what is, how many doses, berapa lama kena ambil, you should go for therapy ke tak. So, do have a listen of the treatment plan. Because the question is what is after diagnosis. And build the support system. Building support system is penting. You have to meet someone from your family members, be vulnerable, tell them that I need support from you, or maybe if you are students, meet your lecturers. If the lecturer doesn't help, toxic ke, tak boleh terima benda ni, you can ask someone, your counselors, or maybe if counselors need support, just stop someone that you very trust about this element. Self-care is important. You have to self-care. Maybe when you admit yourself being diagnosed, you need to take care of yourself. Important. Some patient when go through this kind of stage, there is a denial. They don't really have a self-care. So you should self-care yourself in this condition. That's it from me.
Before we end, once again, I will throw the floor to audience and YouTube viewers. If you have any question before we end, so just stand up. And then the microphone will come to you straight away. Anyone? Okay, so we have one question there. And someone first. Okay, yes, got microphone.
Hai, Assalamualaikum. Saya sebenarnya saya nak cakap saya tak tahu sangat pasal mental health ni. Tapi saya pernah ada satu experience di mana saya dengan kawan saya ada seorang kawan perempuan ni. And memang membesar daripada kecil. Memang selalu bersama sampai masuk jenazah pun sekali lah. Tapi at one point tu, right before COVID start, dia macam mana nak cakap, skizo Dia macam berhalusinasi, lepas tu dia macam nak tolak semua orang, kalau datang kat dia marah, lepas tu dia gelak sorang-sorang. So right now, Alhamdulillah dia ada pergi treatment dekat hospital and dia ada ambil take medication. Cuma macam nak cakap, saya dengan kawan saya tu dah tak rapat dengan seorang kawan tu. Tapi saya macam terima je lah. Cuma kawan saya nak tanya on behalf yang lagi seorang tu, dia macam question dia punya decision sama ada dia patut macam stay jauhkan diri sebab itu yang orang tu nak before waktu dia sakit tu, or just sekarang ni dia perlu datang kat kawan dia tu. So bagi doktor, decision apa yang terbaik dalam situasi macam ni sebab dia melibatkan emosi dan juga logical from standpoint.
Okay, so mungkin condition, okay, keadaan seperti itu is common. Like we, kalau tak ada knowledge, we might see this as, we're not sure until when she will act like that. Okay, so kita akan rasa bahaya tak? Encik rasa dalam bahaya tak?
Bahaya.
Maksudnya macam bila tengok macam tu ada rasa macam takut, how you feel?
Dia tiba-tiba menjerit. Lepas tu hari tu bawa kereta, dia calang kat palang.
Okay. So we have to know this is yang kalau tadi kat graf yang 4 tadi tu. So dia ada mental, she has the mental disorder, but then the mental health state tu kat mana? Okay, selalunya bila dia tengah tak sihat, when she is unwell, she has no insight. Insight meaning has no understanding about the situation. Okay, maybe she is in the hallucination state, yeah. But then when she start the medication, so she at one point dia akan regain balik the insight. So kalau once dia regain insight, actually dia sama je macam kita sebenarnya. Like as normal as like maybe tu yang kata dia boleh back to baseline. Okay, so try to reach her again and then ask her how are you and then try and see. Okay, boleh, tak ada masalah. Okay, skizofrenia ni kalau kita kata pasal skizofrenia, yes, every patient is different, the presentation different, and then the severity. So there are patients coming to us very acute, very early, but then very severe. But then ada juga, ramai juga patient yang sebenarnya datang moderate in term of the severity, but then when we start medication, they come back to near as possible as baseline. So she can back to study, back to work, and then can continue family life. So as usual. Kita ada juga patient yang very good, very compliant to medication even after 10 years. Seriously, datang kat saya, kita tanya, of course kita akan ada set of question kan, ada hallucination lagi tak, ada delusion ke tak. Doktor, saya dah penat dah jawab soalan ni, saya okay. Yeah, so even with this kind schizophrenia, but compliant to medication is very important because this is considered as chronic mental health. Sama juga macam diabetes or hypertension, chronic illness that need medication to control, because this medication is not to heal. This is medication to control. Okay, so yep, we try to reach again your friend and see how the different. Okay, ada additional point ke apa?
Any last question before we end, or any question from you? Kalau ada? Okay, go on.
Hello, my name is Nur Dani. You can call me Danny. So my question is about how to explain pasal mental health, mental disorder to like older generation, like boomers, old people lah. Because a lot of them, they feel like a lot of people, young people like me lah, we use mental health as an excuse bila kita malas ke apa ke, ataupun if we don't feel like going anywhere, doing anything, they feel like, oh, they use the old people think, oh, they use mental health as an excuse, as a way to get out of doing work and all that stuff. And also like there are also cases where like they feel like if I tell them I go to psychiatrist, I go to therapy, they feel like, oh, are you gila, all that stuff, because they like he told me during his time, if someone go to psychologist, oh, they are sakit mental, they are insane, macam tu lah. So how can we explain about the whole mental health, mental disorder thingy to like the old people, how in a way that they can understand, like that lah. Thank you.
Okay, so this is kind of a bit similar situation when for the old. Thank you, Danny, for the question. Similar question, situations like when people talking about mental health, commonly for older people ataupun orang-orang lama, they will say straight away to the shaman, our black magic. So basically, how Dr. or Nazrul can ideas, explain. This is a mental health. This is not magic. This is not shaman. This is mental health. How is it then?
Okay, I think that's a very good question. I usually get such parents with cases involving teenagers and young adults. Sebab selalunya teenagers and young adults, their parents sometimes will come kan, and kalau teenagers, the parents will want to see us. Kalau young adults, it depends on the concern of the young adults lah. Like you guys are young adults. So anyway, coming back to the question, first of all, before we explain to them, we need to have the idea that we cannot expect that they can understand. Why? Because they were brought up that way. Right? So they were brought up in the idea in the 60s, 70s. This is, when you talk about Tanjung Rambutan, there is a whole, when you talk about gila, mental issues, psychologists, basically you'll be strained, you will act aggressively, they have that. For us, we call it in psychology a schema. Schema ni maksudnya sejenis, it's a type of, it's not really a type, it's basically your definition of it lah. So for us to change it, it's super hard. Believe me, it's super hard. In front of me, to be very honest, there was one parent, if I can give an example, the parent, I told the parent, the daughter has depression, major depressive disorder. So when I listened to the parents, I realized that parenting also has to improve. So usually when we talk to parents, we don't directly advise them, you have to do this, obviously they'll be offended lah, right? So there is a way of talking, but to the point, I said something along the lines of, what you're doing is already good, but maybe validating would help first before you advise. Usually, teenagers and young adults, why they are very distant from their parents is because they feel their parents don't understand. Because parents will seek your advice. So when I say this to the parent will say, susah lah nak validate ni, saya tak biasa. I'm not used to it. Penat lah. And then she did that. So to say to Danny, before I answer, first of all, to put your expectations first, to lower your expectations. But two, this is my style, the Encik Nazro. And Farah might have answers. I will usually use analogies. Yeah, I usually use analogies because our parents or the older generation, they will usually be more empathetic if people have physical illness. Like what I said just now, cancer, orang potong kaki, diabetes, kaki tak ada contoh for example, or sakit jantung at an early age, let's say. So I will usually them puan or ada sakit apa ke? Let's say usually they have the 3 serangkai lah. And then they will say, how do you feel when you have all this? They will start saying susah, kena makan ubat, penat, and so on and so forth. And then from there, we will say that penyakit mental pun sama je, cuma dekat dalam ni. Dia pun organ. It's just another organ of your body. Like how you have problems with your heart, how you have problems with your kidney, you have problems with your brain. And that is another organ. That's one way of you telling them how to destigmatize. You cannot expect them to fully understand, but they will, at this point, they'll see, oh, it's an organ, betul juga kan? And then from there, you can start explaining, helping them slowly explain. When it's here, people cannot see. You will not show you will not show clear physical symptoms, but you will show it through your behavior. So when let's say, parents will usually say, anak depression, pemalas dia ni. Tak nak bangun tidur, duduk je dalam bilik. I will always say to them, especially, I'm sorry if, especially for parents who are very Islamic lah, they will usually ask me to advise their children to pray. Obviously, that's not my job. But I will always say to them is that God created, if this is from Islamic perspective lah, the disorder is created like that. When you have depression, you just don't want to go the heck out from your room. You just want to sleep all day long. That's how God created depression. So that's why you need to take all this treatment, right? So in short, Danny, start with analogies, in my opinion. Help destigmatize by saying that your brain is an organ. From there, explain how it affects your behavior. Right? Usually for parents, especially the Muslims, if you really, to be very honest, I find it my cheat way of telling all these parents is try to use an Islamic perspective. You use the word Allah, for example, this for the Muslims, use the word Allah, Allah created this, and then honestly, they will start like, ooh. Honestly. And then from that, it kind of works. Remember, we are not trying to use the religious sentiment, but we have to adapt to these generations. They're different. We cannot blame them totally. Okay? Thank you, Danny. Any other questions?
All right, thank you. That's a really good question. First of all, you have to be patient first. Every generation, they have their own perspective. How you want them to respect you, you have to respect them first. You know, they have their own perspective. They have a little knowledge about mental health those days. So you have better understanding, better knowledge. First, you have to be patient. And number two is you have to be empathy with them. Of course, they have the different view than you. They have the different perspective than you. All right, that's why you have to bring a success story. Those who going through the clinical element or maybe psychotherapy element, you can have to share with them. Let's say this, you have a parents who are very skeptical on this kind of element. Show them, show the YouTube, whatever success story. Those who are having a clinical therapy on this stigma, and then you should know that your parents they have a perspective. Maybe someone who have the giving them bad stigma about mental health. However, you should meet them with a professional. Let's say you bring them to psychiatric or maybe professional to make them clear about their own ideology or perspective. So if you cannot, you cannot make them confident about that, you bring some people. Let's say you bring to hospital, you can talk to your counselors, bring the counselor to talk about mental health. That's something I believe that we can end the generation perspective. Thank you.
Great. Doctor, add some more? A bit?
I think that's enough from our two panels. Very good.
Okay. So hopefully, Denny, this is clear view for you to help or to explain a bit more about mental health, and hopefully it's really helpful for you as well, and then for others. Okay, so before we close our forum, or before we end our session today, so I will try to give a floor again for all panels. So like a 2-3 minutes, not more than that. So the last word or the advice, or maybe from our students or our colleague in here about mental health.
Come again, this question?
Last word or advice.
All right. If you ask me as advice as those students who are struggling mental health or who actually looking for about mental health, please find counselors. You have a counselors in the universities, you talk to the counselors. And number two is your friends, your support system. I know some friends are very toxic. Some friends are very judgmental. Find a positive friend who are giving you a very positive environment, which can support you. And number three is mental health is important. And without mental health, there is no physical health. Thank you so much.
I've talked a lot, so I'm not going to say much. I just want to say that I believe that worry ends when faith begins in yourself. That's how worry will end, right? And take care of yourselves as well.
Okay, so my last word, okay, so same as physical health, you can see your physical and you can go to gym to improve your physical. Same goes to your mental. Okay, this mental, your way of thinking, your way of dealing with stress, your way of dealing with society, for example, or friends or family. Okay, so you have to improve on way of thinking. Okay, kita bukan kecil selamanya, kita bukan kanak-kanak selamanya. So basically, when we grow, we have to grow our thinking process, our perspective. So we don't stick at one perspective at any situation. Try to improve your perspective, your view, not only from one side. So kalau ada kegaduhan ke, any situation, any issue, try to see in another perspective because we are adult now and we have to improve along the way. Okay, so kita ni kalau kata hidup ni sepanjang hidup pun kita belajar sebenarnya. Kita tak stop waktu student je lah. Even kita nanti contoh dah bekerja, yes, you learn a lot in workplace, and then you get married, again, you learn how to deal with your partners, and then you have children, again, this is being a parent, you learn a lot from our children. Okay, so I think the point is to keep learning, even for your mental health. Okay, thank you.
Great, thank you so much. Learning, and then please find your full support, and then after that, seeking for help for professional or your friend as well. So as I mentioned before, I'll just try to share a bit with you, mentioned by Dr. Mr. Nazrul and Madam Sofia just now. If you try to find or seeking for help regarding for mental health, so basically you can find anywhere. So basically, if you can find klinik kesihatan mentioned just now, and we have a Mentari or Pusat Kesihatan Mental Community, okay, and hospital kerajaan or swasta. And one more thing, you can get directly, or you can get the help or seeking for help from the what do you call it, hospital university. So basically, we have PPUM, we have Pusat Perubatan Universiti Kebangsaan Malaysia HKM as well, and then we have UiTM Sungai Buloh, and then part of that we have hospitals Universitas Malaysia as well. So this is kind of a hospital you can seek getting for mental health. Well, you need to get the appointment for that. But we still have the government agency, as mentioned by Mr. Nazrul just now. We have the Talian HEAL, stand for Help with Empathy and Love, and the Talian is 1555. So 145 we call it for Talian HEAL. And then if you heard before the Talian HEAL, because Talian HEAL just been launched, I think last year October, yes, 21st October been launched by Kementerian Agriculture. And then part of that we have Talian Kasih. Before the number is 15999, and now you still can searching through the WhatsApp. This number is 019-2615-999 as well. So either one you can use that regarding from that. And part of that mentioned by Madam Sofia, we have the NGOs. There's plenty of NGOs being offered the free regarding for the mental health, and the famous one is Befriender. We can find at Penang, KL, and Ipoh, something like that, somewhere in Malaysia. And second, we have a women organization or WAO. Same goes offering for the mental health for help as well. And then we have Helpline Niasa, mentioned by Madam Sofia just now. And then part of it we have SNAM Malaysia, and we have Talian Rahmah. And then we have PS the children, and last but not least we have Malaysian Mental Health Association. So Malaysian Mental Health Association, MMHA. So this kind of NGOs can help you regarding for mental health as well. Okay, so to close or conclude for our forum today, once again, thank you so much for our panelists for today to support and join us for the forum. Okay, before we end, I would like to thank you so much to all committees, for the XSD staff, for SSC members, and UIC for such a great program. Remember, mental health is real, and you are not alone, and don't be alone. Okay, we are here to provide and give a support to you. Okay, regarding for the end of program, so you can reach all the information as I mentioned just now through the MOH, which is Ministry of Health Education. This is the template. So if you want me to share with you, I can share with you later. Okay, we can through the website or something like that, and you can go through by yourself. Which one, as mentioned by Madam Sofia just now, kalau you kata seorang tak boleh bantu you, ada 10 orang lagi bantu you. So please don't stop seeking for help, especially for the mental health. Okay, so just need to be remind again, our program is started from today until 26. So for those just living nearby or working nearby to Uniraza, you still can come to join us for blood donation. We open until tomorrow 3 o'clock in the afternoon. Still have a session for that. and then we still have a booth for the health checkup, and then same goes with that. We have Jiwa Damai in here. Our what do you call it? Let's say the what do you call it? Special for the clinical psychologists. We try to help you regarding for your mental health level. You can do so. It's a free downstairs. Tak payah bayar. Ini free Madam Sophia? Tak payah bayar kan? So it's free for today. Okay, you can seek for that. Just want to check regarding for your level of mental health. Okay, and come again tomorrow. We still have the awareness talk regarding for dentists, and then second we have regarding for the women health. So we're talking about the physical and mental for the woman health. Okay, so once again, thank you so much all panelists. Sorry for that, take your time for today. Dipahamkan ada yang tak sihat and then still working for today. Thank you so much. Once again, before we end, I would like to invite all the panelists, okay, together with all participants in the comments to take a photo session before we end. Once again, thank you so much for that, and then thank you so much for the viewers in YouTube Live. Inshallah, we'll see you again. Assalamualaikum warahmatullahi wabarakatuh. And very good afternoon.